The role of masks in reducing the spread of SARS-CoV-2 infection, the virus that causes COVID-19, is perhaps one of the most critical public health questions of the moment. A new study published in Annals of Internal Medicine sheds some light on the protective effect of masks on those who wear them.
Our trial of more than 6,000 participants here in Denmark found similar rates of SARS-CoV-2 infection in those who did and in those who did not receive a recommendation to wear a surgical face mask when outside the home.
The researchers from Copenhagen University Hospital randomly assigned about half of the participants to a recommendation to wear a mask whenever they left the house. Surgical masks were provided, and the participants were given specific instructions for their use. The other half did not wear masks. Both groups were tested for SARS-CoV-2 at baseline weekly if symptoms developed and at 1 month.
Our findings offer evidence about the protective effect of masks, meaning the degree of protection mask wearers can anticipate or expect when wearing a mask in a setting where others are not wearing them, but when other public health social distancing measures are in effect. Our study does not address the effectiveness of widespread mask use for preventing the spread of infection from those infected with SARS-CoV-2. The data were compatible with some degree of self-protection.
Public transportation and shops remained open in Denmark during the study period, and mask use was uncommon outside of hospitals. Recommended public health measures during that time included social distancing, quarantine of persons with SARS-CoV-2 infection, limiting the number of people seen, frequent hand hygiene and cleaning, and limited visitors to hospitals and nursing homes. Annals editors warn about misinterpreting the findings about mask wearing.
These findings do not mean that widespread mask wearing during the pandemic is ineffective. Rather, this trial shows that people wearing a mask, among others who are not wearing masks, remain vulnerable to infection. Other studies suggest lower spread of infection in settings where most people wear masks. What we know from those studies, plus the current trial, should motivate widespread mask wearing to protect everyone.
For me, not least as a physician, it's very important to underline that our findings suggest that people should not abandon other COVID-19 safety measures, regardless of the use of masks.
Some question why Annals would choose to publish research that could easily be misused by those who see mask recommendations as an infringement on personal liberty.
Annals of Internal Medicine published this carefully designed randomized trial because it informs our understanding of the role of masks in mitigating the pandemic. It would be irresponsible to squelch the findings because they did not show what we hope to see as advocates of mask wearing.
For more information, go to annals.org.